Hello, future nurses. I am Dr. Caban, and today's presentation will cover the content in your textbook beginning on page 407, chapter 24. This content is titled Diagnostic Tests and Specimen Collection. Let's get started. So this presentation of chapter 24, I'm going to bring to you in three different parts. Lesson 24.1. Here, upon completing this part of the lesson, you'll be able to discuss appropriate psychosocial care and education for those patients you are caring for who would undergo diagnostic tests and/or procedures. You'll also prepare to perform a capillary glucose test, a venipuncture, a throat culture, an electrocardiogram, a urine dipstick test, and a stool for occult blood test. In addition to that, you'll be able to describe each of the categories of tests that are commonly performed. After completing the review of this presentation, as well as completing your reading assignment of chapter 24, you'll gain knowledge that you can bring to the clinical practice setting. You'll be able to provide pre-test and post-test nursing care, including appropriate education for patients undergoing diagnostic tests and procedures. You'll attend to psychosocial concerns of patients undergoing various diagnostic tests, and also perform a random blood glucose test using a capillary blood and a glucometer. So diagnostic tests and procedures provide important information about complex chemical reactions that affect the body's function. There are laboratory exams of the blood, urine, and other body fluids and tissue which can provide accurate information about the function of various organs and physiologic mechanisms. When there are diagnostic tests ordered, your role as a nurse should be to assess what the patient knows about the test. Also, determine if there are any special nursing measures needed to protect the safety of your patient. Assess wounds each shift for signs of infection, and also assess whether or not your patient has allergies to medications and to iodine. In this slide, you have a list of various nursing diagnoses that you can use when caring for your patients, but remember that the nursing diagnoses are pertinent to the problems for which the diagnostic test or procedure is performed and ordered, and is based on your patient's needs and your patient's assessment. So remember, you're going to assess your patient and obtain information from your patient whether or not they have knowledge regarding the diagnostic tests or procedures that are being performed. In that particular circumstance, if the patient doesn't have knowledge, then an appropriate nursing diagnosis should be deficit knowledge related to, again, that particular diagnostic test that is appropriate for your patient. Additional nursing diagnoses listed here would be impaired urinary elimination related to dysuria and foul-smelling urine. This diagnosis can be used for individuals who are having a urinary culture performed. An additional nursing diagnosis is pain related to raw or sore throat for those individuals having a throat culture conducted. And then also we have pain related to inflammation and swelling at the wound site. And of course, you can use this diagnosis for individuals who are having culture performed for wound care or wound care culture. You've assessed your patient. You've derived with some nursing diagnosis based on your assessments. Now you have to plan your nursing care and interventions appropriately. It is best if you prepare yourself ahead of time before implementing any kind of care for your patient. planning is crucial to ensure safety and ensure that the patient has a pleasant stay and experience. So before proceeding, check with the pharmacy and hospital supply department for any necessary equipment and supply you may need for your patient undergoing procedures or diagnostic tests. Verify that you have all items at hand. So basically, be prepared. Ensure that the pre-test medications are available if any are prescribed for your patient. Certainly prepare yourself to do patient teaching. Prepare yourself to provide adequate treatment for your patients, such as preparing enemas or IV equipment ahead of time. And there are expected outcomes that should be written for the particular nursing diagnosis that you've identified for your patient associated with the problem for which the test is being performed. So, assessment, nursing diagnosis, planning. The next stage of the nursing process is implementation. You've now prepared yourself to implement the nursing intervention. Again, be prepared to assist the physician and patients during the procedures or diagnostic tests. Many diagnostic tests require measuring vital signs frequently when the patient returns to the nursing unit. Please be careful in considering when you're assigning vital sign measurements to unlicensed professionals after invasive diagnostic procedures. Vital signs are not the only parameter that are usually needed to be assessed. The patient may need to be monitored for bleeding, neurological abnormalities, decrease in sensation or function, increasing pain, and general changes in condition. The licensed nurse's assessment should encompass all considerations for your patient. So when you're implementing care, make certain that the patient has received adequate teaching about the test procedures or diagnostics that are being performed, carry out the pre- and post-test actions for the particular test or procedure order, and obtain a signed consent from your patient for any invasive procedures that require one. So what are diagnostic tests? Before we talk about diagnostic tests, let's talk about your role in ensuring that your patients are prepared for diagnostic tests and procedures. First and foremost, all invasive tests requiring injections of a medium do require consent. Testing that involves premedication or sedation usually requires consent. So before you proceed with assisting your patient to having a diagnostic test performed, please be sure that they are well informed and consented. Diagnostic tests provide the information about chemical reactions affecting physiologic functionings of the body. These tests enable an examination of blood, urine, and other body fluids which provide clues about the functioning of various organs, body systems, and mechanisms. They are used to confirm diagnosis and guide treatment. Also, they provide information concerning changes in a patient's condition. Let's familiarize ourselves with laboratory tests. These tests can be performed on body fluids or tissue to determine changes from the normal state. A type of laboratory test is your hematology test. This test is the study of blood and its components. The complete blood count, also referred to as CBC, provides you with information about the state of health or presence of an illness. Please refer to Table 24.1, page 410 in your textbook. This provides you with information of examples of complete blood counts for adults. The hematology test provides you with information regarding the patient's hematocrit. The hematocrit refers to the separation of blood and is the amount of blood cells in relation to the amount of plasma. It is decreased in individuals with anemia, also referred to as low red blood cell count. And it is also decreased in individuals with massive blood loss. On the other hand, hematocrits can be higher than normal in individuals with dehydration or shock. In the hematology test, individuals can be tested for the level of hemoglobin and platelets as well. Hematology test measures the white blood counts, or your WBCs. During an infection, the number of type of white blood counts increase. This increase is referred to as leukocytosis. Neutrophil counts can be significant. In individuals with severe infections, bone marrow releases more granulocytes. Also, immature polymorphonuclear neutrophils are released. These are called bands. The result is referred to as a shift to the left. So what does this phrase refers to? It refers to cells are reported on the differential white blood cell count based on order of maturity, with less mature cells forms, such as bands, on the left of the report is indicative that the individual may have an infection. Please study this content in your textbook on page 410. Again, a shift to the left may indicate that there is a presence of an infection. When you're reviewing your patient's hematology reports, look at values that fall outside of normal range. You're concerned with those high values just as much as you are concerned with the low values. So when you're looking at the CBC report and you're reviewing the leukocyte reports, if you see that there is a decrease in leukocytes, this means that there may be leukopenia. That individual, therefore, will be at risk for infection. Also, reviewing the patient's hemoglobin levels, if you see that there is a decrease in hemoglobin levels, then there may be some bleeding within the patient's body that's occurring. Outside of the CBC count, when reviewing the hematology reports, you can look at some of the tests of bleeding and clotting times. Review the patient's platelet information. Their platelet counts should be within normal range. Normal range is 150 to 400 cubic millimeters. This is important because this number is concerned with clotting time. What happens when the platelet count falls below 20,000 cubic millimeters of blood? That means there's been spontaneous bleeding occurring. Familiarize yourself with these values because you want to review these lab values before the patient undergoes any kind of diagnostic procedure where there is a concern for a higher risk of bleeding, such as extensive dental extraction. When you're assessing your patient and you're reviewing their chart, identify patients who are on warfarin therapy because warfarin therapy puts patients at greater risk for bleeding. Warfarin therapy is measured by the prothrombin time. This value is reported in the INR numbers. The erythrocyte sedimentation rate gives clues regarding inflammatory conditions. If this number is higher, that means there may be a presence of some kind of inflammatory condition. Now we're going to discuss blood chemistry tests. These tests are conducted to detect changes in biochemical reactions in the body and determine a diagnosis. Food and drinks are usually withheld 8 to 12 hours before blood chemistry tests are performed. Chemistry laboratory tests are performed on whole blood, plasma, serum, and other body fluids such as urine, spinal fluid, and gastric content. These tests provide information about the electrolyte balance, the ability of the body to metabolize nutrients, the function of the organs, and the presence or accumulation of any toxic substances. An example would be blood glucose test. This test is essential in diagnosing and controlling individuals with diabetes. Please refer to your textbook on page 24.2, page 410, blood chemistry tests and their purpose. There's a list there. And that list provides information regarding the bilirubin, ALT, ALP, which is used to measure liver function, information regarding your BUN and creatinine, which is important indicators of kidney dysfunction, and then your lactate dehydrogenase, creatinine kinase, and aspirate aminotransferase, which detect damage to striated and heart muscles. Again, this information can be found in your textbook on page 410, table 24.2. Many blood specimens for CBC and chemistry or serology tests are usually obtained by venipuncture. This refers to a puncture of the vein with a needle. Please refer to page 411 for additional information. Blood glucose tests can be performed either by venipuncture or by a capillary finger stick. The mechanism of conducting a finger stick can be done at the patient's bedside by the physician or by a nurse, or if it's in the patient's home, the patient themselves can conduct this kind of test, or a home care nurse can do this as well. This information is important because it provides the individual's provider with information on how the patient's managing their diabetes, and it can be used as a guideline for adjusting the individual's insulin therapy. Please refer to your textbook on page 414 through 415 in reviewing the skills for conducting the capillary blood finger stick. And also familiarize yourself with the equipment that is necessary to conduct this type of test. Remember, before performing any kind of procedure, make sure that you have all the equipment at hand and prepare yourself ahead of time. Serology tests are based on analysis of serum. This refers to the study of serum for its antibody content. It is used to diagnose both viral and bacterial diseases or determine antibody levels for dysentery, rheumatic fever, typhoid, influenza, rubella, and syphilis. It is also used to determine titers in response to certain vaccines. Radioimmunoassays detect the minute particles of protein in the blood. Blood typing and identification of blood factors may also be carried out in the serology section of the laboratory. Examples of serology test order are indicated here on this slide. Most serology tests can be performed without restricting the patient's food or fluid intake. Additional laboratory tests include urinalysis. Urinalysis is used as a screening and diagnostic tool because it can detect different metabolic and kidney disorders. In some conditions, it is also essential because it provides an assay of economical and relatively fast tests to monitor ongoing patient progress. Urine composition varies according to the fluid intake and diet, and urine specimens can be classified as single, catheterized, or random specimens, midstream specimens, timed, or long period specimens. A midstream urine collection is a routine urinalysis that may be conducted when the patient is admitted to the hospital. It is used for culturing when a bladder infection is suspected. This test can also be useful in monitoring whether a condition is getting better or getting worse. When conducting or collecting a midstream, the external genitalia are cleansed, a small amount of urine is passed first, and then urine is collected from midstream, voiding in a sterile container. Timed or long period specimens usually are collected over a 12 or 24-hour period. The container may be kept on ice and has some form of preservative. It is used to determine kidney function and possible glomerulonephritis or acute tubular necrosis. Please familiarize yourself with patient education regarding collecting a 24-hour urine specimen. This is found in your textbook on page 411. Remember, when giving the patient instructions for collecting a 24-hour urine collection, inform the patient to empty their bladder into the toilet and begin timing collection for the specimen. The first urine is discarded. Collect urine for 24 hours after that and have the patient provide last voided specimen at exactly 24 hours after starting the collection. Additional laboratory testing are your bacteriology, histology, and cytology tests, your tests for oval and parasites, as well as cultures from specimens of feces, blood urine, wound drainage, or samples of body tissue or fluids. In your textbook, you can find information on these various types of testing, beginning on page 419. Please familiarize yourself with the steps in obtaining and testing for occult blood in the stool. This is found on pages 419 and 420. Right, so we've completed part 1 of diagnostic tests and specimen collection. Let's review some questions. So question 1 pertains to what we reviewed in the beginning of the presentation. We talked about you assessing your patient and identifying learning needs and then developing a nursing diagnosis based on your assessment. So which of the following nursing diagnosis is used when a patient needs teaching regarding a diagnostic test? Is that nursing diagnosis impaired verbal communication related to changes in the mind? Is it readiness for enhanced communication related to impaired vision? Is it deficit knowledge related to diagnostic tests? Or is it impaired verbal communication related to hearing aids? I think for the most part, many of you may think this is pretty obvious, and it is. The appropriate nursing diagnosis here is C. It is deficit knowledge related to the diagnostic test. Again, when you are assessing your patient upon admission or assessing your patient before they're having a procedure conducted or any kind of diagnostic test conducted, you're assessing their learning needs. If you have identified there are learning needs and the patient is not familiar with the particular test, then you can come to the conclusion that there's a deficit there, a learning deficit. So you would devise the diagnosis deficit knowledge. Question number 2, which of the following tests is commonly performed to detect changes in biochemical reactions in the body and to determine a diagnosis? Is it A, hematology test, B, blood chemistry test, C, urinalysis, or is it D, serology test? Remember that the correct response here is B. Blood chemistry tests are commonly performed to detect changes in biochemical reactions in the body and to determine a diagnosis. Okay, we're going to take a quick break from this first section. We'll proceed to section 2 shortly.